So for this afternoon, our topic is still on the pathophysiology framework, and we will discuss accordingly on how the framework from the risk factors to the etiology and how to use the pathogenesis when it comes to the direction of your pathophysiology framework. Our topic for this afternoon is related to pathogenesis and pathognomonic sign. Pathognomonic sign is very helpful for us nurses so that to identify the specific manifestations that are expected and peculiar for specific disease or diseases. Now, let us start with the discussion of what pathogenesis is. So I missed the actually when it comes to the pathogenesis, this considered also similar concepts as chain of infection and for the concepts pertaining to periods of diseases. When it comes to pathogenesis, it is similar also on the concept on how to utilize the various concepts such as cause, incubation time, manifestations, and at the same time, it will utilize the recovery. So these are the four concepts under the pathogenesis. When it comes to cause, this is referring to the exposure or inoculation. So what I'm projecting now in the slide is a typical example of common colds. Okay? So the cause of this common cold is pertaining to the exposure of the host or the person and inoculated by the virus. So that is basically the cause. So it's most probably exposure is environmental. Okay? Then when we talk about the incubation time, this is the time wherein it is expected that the virus will multiply or the virus multiplies. And as it multiplies, it leads to the number three, which is manifestation, wherein the host begins to have the signs and symptoms, such as, for example, for a common cold, we have sore throat, itchy eyes, runny nose, and the last phase of the pathogenesis is recovery. So just the same as when you are about to design your pathophysiology framework or diagram, it will always start with the cause. So that is what we call risk factors. So we have already identified what are those risk factors, such as the modifiable, non-modifiable risk factors, if there are lifestyle that is relevant to the development of disease, and social factors. So as it increases the multiplication of either virus or bacteria, it will affect specifically the body when it comes to physiologic response. Initially, it may have compensatory mechanism, but if the body cannot anymore compensate, that is the time that it may develop chances that the cells are not responding anymore to its definite function. So that's why chances it may lead to the decreased response of our immune system. There could be possibilities that it may not naturally may inhibit the multiplication of the virus and the bacteria. So that's the time that as it continues to increase the and multiply its number, it goes with the manifestations. And once the client recovered, and actually what could be the basis and the measurement that the client already have recovery or had achieved recovery is the absence of the signs and symptoms. So when it comes to the pathogenesis, this is basically the direction of how a certain disease from a cause up to the recovery have developed. So I just want to give you a typical example of a situation which is very much common with our situation today. The client suspecting 2019 nCoV infection. So that's what before it was all nCoV. So now we have the COVID-19 infection, which is suspecting from a person-to-person spread, which occur mainly via respiratory droplets and produce when an infected person coughs and sneezes, similar to how influenza and other respiratory pathogens spreads. Symptoms of I may replace it with COVID-19, may appear in as few as 2 days or as long as 14 days. That's 14 days after exposure. Symptoms can include fever, cough, and shortness of breath. Client recovers out from isolation room. So let us now identify from the pathogenesis what are the cause, the incubation time, the manifestation, and the recovery. So very obviously in this situation, that the cause is mainly the person-to-person spread, okay? And the cause is specifically the COVID-19 virus. The incubation time wherein it is expected that the virus or the COVID-19 multiplies is from 2 days up to the maximum of 14 days exposure. Okay? So that is usually the incubation time. Now, when we talk about the manifestations as presented in the situation are the following: fever, cough, and shortness of breath. While when it comes to the recovery, the evidence that the client already recovered is when the client has been pulled out from isolation room. It means that the recovery that we are emphasizing here is the client may not have any more the signs and symptoms, and with that observation, the client may be out of the isolation room so that to facilitate full recovery. So this is a typical example of pathogenesis, and hoping once you make your pathophysiology framework, it may also indicate the time that how the virus enters the body, how the virus specifically cause these manifestations, and how the virus will prevent or inhibit its multiplication to achieve full recovery. Another example that I may give to you a situation is all about bird flu. Okay. So the bird flu is this is H5N1. Okay. This was identified as a problem before with migratory birds that carries the virus of the H5N1. And usually when it comes to the bird flu, the most virulent of the bird flu virus, they are considered as what do you call this? They have been considered that as reservoir. So that's why the humans can have the infection if the client or the person may have close contact in an infected poultry. So just like as for these chickens, na wherein it considers that the bird or the chicken excrete the virus or carry the virus and excrete it in the feces. So the portal of exit from the reservoir is mainly through the feces. And once the pulverized species with the virus will be inhaled or touched by the person, so this mainly may cause the entry or the portal of entry of the H5N1 virus to the person. Probably since the body do not have any immunity at all with this virus, so most probably there's no immunity against this virus. So those the manifestations are usually, or the signs and symptoms are usually similar to common influenza. And usually when this could be untreated, treated if it is treated, then we expect full recovery. If the client will be untreated, there will be a rapid deterioration because of the viral, it may lead to viral pneumonia. And the viral pneumonia may lead to respiratory distress, may lead to kidney failure, and soon may lead to multiple organ dysfunction. So this is somehow similar with COVID-19, wherein it caused also multiple organ dysfunction. So let us now relate the use of the pathogenesis when it comes to the bird flu or H5N1 infection. So what is the cause? The cause is obviously the virus, okay, which is the H5N1 virus, the incubation time. So the incubation time is similar to the influenza, which usually occurs also 2 days up to 14 days. And such, the manifestations are the following: fatigue, fever, conjunctivitis, sore throat, cough, and muscle aches. So when you are about to defend your pathophysiology to the panel, it is very much important to identify. You will not put fatigue, you will not put fever, you will not put conjunctivitis, sore throat, cough, and muscle aches. It will reflect more in the pathophysiology diagram on why, because most of the pathophysiology answers why and the whys and the hows. How and why it causes fatigue, why and how it causes fever, why and how it causes conjunctivitis, why and how it causes sore throat, cough, muscle aches. Now, our evidence of the recovery of the client is if the client do not have any more those manifestations. Okay, so these are the examples of how the pathogenesis comes in when you are about to do your pathophysiology. Now, in the pathogenesis of disease, pathogenesis may be classified in terms of acute or chronic. Okay, when it comes to the acute disease, these are disease of sudden onset and runs a severe but short course. Okay, so what do we mean by that? Uh, if there is a sudden increase in the or rise in the temperature, or as an example, severe pain for acute, that's why it's acute appendicitis, because the onset is very sudden but severe. Try to imagine the severe pain that is sudden, but the course or the disease runs with the inflammation of the appendix, and it's very crucial. Once the appendix will be ruptured, it may cause toxins to the different parts of the body, specifically with the circulation. So that's why it may lead to possible fatality. So acute disease, just remember, sudden onset but runs to severe of a short course. So okay, that's why it's acute, very short, but identified as severe. On the other hand, if we say chronic disease, these are long term, which may possibly recur. Example, arthritis, which may persist in a long time. The patient may the patient may recover, but eventually, sooner or later, may lead to another arthritis attack or pain. Another example for the chronic disease is that of diabetes, which eventually, our reference for diabetes is the level of blood sugar. And thus, if the client recovers from the situation of the and stabilized with the blood sugar, then eventually the client sooner or later may again a problem or risk of a problem of increased blood sugar. So these are situations wherein chronic disease may happen anytime, may have an attack. Unlike for the what I have mentioned, for acute appendicitis, the client may have high fever because of inflammation, sudden pain on the right lower quadrant. But eventually, once this has been treated, it may not again recur. Unlike for diabetes, unlike for heart diseases rather, epilepsy, which is it really direct it may have a direct effect on the brain. These are chronic diseases. So that's why our term here for chronic disease is reoccurring. Okay. So are there any questions so far from the virtual room? Any questions so far? May I hear
Wala
responses?
naman po.
Okay, thank you so much. Now, so it's clear. Now, we have also used the term idiopathic disease. Okay? When we use idiopathic disease, these are diseases of unknown cause. Okay? And usually, from an unknown cause, it will further discover the cause accordingly through series of diagnostic examination. So there is no such as definite cause of these diseases. So just like if we have an example of myocardial infarction, in myocardial infarction or heart attack, there are definite causes. Another example, cerebrovascular accident such as or CBA or stroke, we can enumerate specifically the causes of the disease such as the stroke. But for some that uses idiopathic disease in the diagnosis, it means that it's on the perspective of unknown cause. These are the examples: acute, idiopathic, polyneuritis. So it used the term acute, sudden but severe. Okay, idiopathic of unknown cause, polyneuritis, poly multiple neuritis is inflammation of the nerve. So eventually, there's a sudden severe unknown cause of multiple nerve inflammation. So how about if it uses diffuse idiopathic skeletal hyperostosis. Okay. If we consider diffuse idiopathic from the term itself diffuse, what does it mean if we use diffuse? So probably from the term itself diffuse, okay, it causes the specific change in the structure. And if we consider the idiopathic, so again, we have the consideration of the what we call unknown cause. Okay, what comes next? When it comes to skeletal, okay, so what do you mean by skeletal? Skeletal is the involvement of the bone. And next is hyperostosis. If we say hyperostosis, this is related to excessive growth of bone tissue. So that's why even with these terms, we can identify diffuse. Okay, diffuse. It may cause that change in the structure. Idiopathic, unknown cause. Skeletal, involving bone. Hyperostosis, excessive growth of the bone tissues. But still, it's idiopathic, unknown cause. Another, idiopathic pulmonary fibrosis. Okay, when we talk about idiopathic, okay, so this is certainly unknown cause. If we say pulmonary, it is certainly related to what? Certainly related to the lungs or the respiratory system. And if we say the what we call fibrosis, um, if we say fibrosis, this is related that it causes a scar in the lungs. But that is different from cystic fibrosis. It causes a damage with lung tissues, but it started with the production of sticky mucous secretions. That's for cystic. But if we say idiopathic pulmonary fibrosis, idiopathic unknown pulmonary lungs, or respiratory fibrosis is referring to scarred tissues. So still, if it's unknown cause. How about idiopathic scoliosis? If we say scoliosis, what does it mean? If we say scoliosis, this is a deformity, okay? So a deformity wherein it characterized by the curvature of the spine, okay? But having this problem of the curvature of the spine, since it used the idiopathic, so it is still unknown cause. So that is what we call idiopathic disease. How about iatrogenic? Iatrogenic disease is a disease arose as a result of a prescribed treatment. Okay? So if we say prescribed treatment, for example, the client is subject for these are the following as presented in the slide. We have the what we call steroid therapy. We may have the chemotherapy. Then uh, we may have the salicylates and corticosteroid therapy. Salicylates are more on the aspirin therapy, and Parkinsonism from antipsychotic drugs. Okay. So as nurses, if the client is on steroid therapy, okay, we expect that the steroid may lead to what we call possible Cushing-like syndrome. Okay. Because we may not expect that we must take as nurses we must take into precaution to monitor the client who is or who are on steroid therapy, because once the client will be on steroid therapy, what do you need to monitor is the Cushing-like syndrome. So what do you mean by the Cushing-like syndrome? If we will try to have the Cushing syndrome, actually the Cushing syndrome is the what we call hypercortisolism. Okay? The cortisol is released by the adrenal glands for purposes of the anti-inflammatory property. But too much steroids or frequent use of the steroids may lead to the possibility of too much cortisol production as a normal response of the body. So that's why the client on a steroid therapy may result to hypercortisolism, or the what we call increase in the production of cortisol by the adrenal glands. Another, chemotherapy. Okay, we are aware that chemotherapy is not a treatment, a supportive, okay, as what we have mentioned in pharmacology. So this is a treatment if it may lead to total recovery to clients with cancer. However, since in the chemotherapy drugs, this may lead to the possibility that also the healthy cells will also be affected. So that's why for most who may have chemotherapy, the client could be high risk or anemia, or it may lead to the possibility of immunosuppression. So it may lead to the possibility of it may lower down immune system. That's why pag sinabing the client has anemia and it is considered as iatrogenic, it is brought about, the anemia was developed, brought about by the chemotherapy. So just similar as what I have mentioned in the first example, that the client may have Cushing syndrome or Cushing-like syndrome because of the result of steroid therapy. Another, uh, if the client is on the salicylate, okay, salicylates are the most examples here of salicylates are the aspirins and corticosteroids that are the most of the example are the zones. This may lead to the possibility of salicylates and corticosteroid therapy may lead to the possibility of peptic ulcer. So we have mentioned before that most of the steroids and salicylates may cause irritation of the gastric mucosa. So eventually, if this will not be taken on a proper precaution, it may lead to possible peptic ulcer. So possible that the client develop peptic ulcer because of salicylate and corticosteroid therapy. So that is iatrogenic disease. Another, when the client is taking antipsychotic drugs and the client develop Parkinsonism. So in the Parkinsonism, there is an alteration in the neurotransmitter specifically affecting muscle contraction or control. That's why it may cause some of the problems with mobility, or rather with the uncontrolled muscle contraction. So in this situation, we are aware that these are the examples of some of the therapies and treatment but may lead to a specific disease. So that is what we call iatrogenic. Unlike for idiopathic, it was identified that it is unknown. Now, how about nosocomial infection? Nosocomial infection are acquired. Okay, the client, for example, do not have any infection, but the client acquired the infection through the setting, through the hospital or any healthcare facility. So just like, for example, post-operative patient develops staphylococci infection from surgical instrument that was not properly sterilized. So what is the cause of the disease of having the staphylococci infection? The problem with the sterilization of surgical instruments. So it is brought about by a possible cause by a circumstance like the instrument that had not been properly sterilized. Another, a child develops cold after exposed to other sick children. So the possibility that the client or the child develop the cold with the exposure for those or to those who are sick. Okay, so probably moderate colds or moderate respiratory problem to severe. So they have been exposed, they have developed, but they are still in the premise of the hospital. So these are nosocomial diseases. There are some situations that it's different if it is just simply as nosocomial disease is hospital acquired, but it is different as community acquired. Okay, so that's why you've heard about community acquired pneumonia. So meaning it's not the pneumonia had not been developed in the hospital, but within his environment outside the hospital. If it is hospital acquired, that is considered as nosocomial infection. Next, let us now proceed with the manifestation. Manifestation is also called as a clinical presentation of signs and symptoms. It is actually the clinical evidence or effects of disease. Okay, that's why when you have identified and have the interview of your client or gathered data of your client and presented the manifestations, again, in your pathophysiology, you will not put the signs and symptoms. You will not put the manifestations. However, you must have the confidence to explain why the client developed such signs and symptoms or manifestations. So these are, if the client develops the fever as our objective data, then there must be something that you must explain and you must be aware why the client has fever. So we may need clinical evidence. And remember that fever may not just only be associated with infection, it may be also associated with inflammation. Okay? In these situations, as we proceed with the clinical presentation, we have the what we call local manifestation. From the term itself, localized, it can only be identified to the specific site or area. It is usually the response of the body when it comes to either irritation or injury. So these are the examples of the what we call uh, local manifestation. So what do we mean by this? Redness. Okay. So if we say redness, what does it mean? The redness itself, if you will identify specifically uh, redness, you will not put redness in your pathophysiology, but you must discover and elaborate what is the cause of redness. So, for example, if the client was exposed to sunlight, and if the client was exposed to sunlight, if the sunlight has ultraviolet rays, and the ultraviolet rays may cause irritation of the skin, may cause dryness of the skin, thus may lead to the irritation of the skin. Actually, it may start first with the redness. It may start first with the redness of the skin. But the next question is, what is the cause of redness? Any irritation in the skin, there is a chemical mediator such as histamine that is very evident to identify that the response of the histamine leads to the redness. And that is very evident when it comes to inflammatory process. Another is swelling could be identified specifically on extremities. Just like if there will be actually swelling that we are talking about here in general is swelling because of inflammation of tissues or swelling brought about by presence of accumulation of fluid. If it is referring to accumulation of fluid, we are referring to pitting edema. Pitting, Pitting. If we are talking about the swelling is caused about by an injury or caused about by the skin, which cause its bulging and increase in the tissue due to the irritation and injury, that is non-pitting edema. So just like in colloquial, the pitting edema is manas, and in colloquial, the non-pitting edema is maga. So that's a different description when you're using these two. But in general, it's swelling. We're talking about swelling. Now, when we talk about abscess, the abscess could be presence of pus, okay, on a specific site, which leads to the possibility of infection, which is somehow an evidence, a clinical evidence of infection, but only on a specific site. Okay, cellulitis is obviously from the term cellulitis, itis, inflammation, but the cellulitis is caused about by the severe bacterial infection. So, what do you mean by a serious bacterial skin infection? A serious bacterial skin infection that could possibly may lead to a swollen, red, typically painful. So, there are some situations that you will be bitten by a bee or an insect, and once it causes the redness on the bite of the insect, and next what comes in is it causes the redness, then afterwards it causes the swelling, then leads to the presence of the pus. So if you will notice, when it comes to cellulitis of a severe bacterial skin infection, all of the mentioned first three are identified. The redness, the swelling, the abscess are present. So that is cellulitis. But this only be identified in the specific area. Next, how about systemic manifestation? For the systemic manifestations, so very obviously that we are using this term systemic because it affects single organ, the single organ affecting the entire body. So these are general indicators of illness. Okay? If we say fever, we cannot only identify, okay, we can identify possible infection or inflammation. However, we need to know what specific organ is affected. So systemic. Okay, lethargy. Lethargy is a term used as a change in consciousness, and most lethargy is the wherein the client is drowsy. So, if the client is drowsy, from alert to drowsiness, most of our indicator here is it affects the central nervous system, specifically the brain. But with that manifestation, we are still not aware of what specific part of the brain is affected. Okay, but we have already identified that when we talk about lethargy, it's the brain that controls our alertness. The general body ache and the general body weakness could be systemic in manifestations. However, this could be general indicators and still may not specific or may affect the entire body, and It may not identify a single organ or a body part. So unlike for the localized, it can identify directly to the specific organ. Unlike for the systemic manifestation, is general in approach. When we say fever, we cannot say what part of the body is affected. When the client has changed in consciousness, we cannot say that it's only affecting the brain, although the brain is the one that controls the consciousness, but probably there are other factors. General body aches or pain may significantly identify different pain sites, but it may not specifically identify a disease. General weakness could be a manifestation of various diseases, but it may not specifically identify single organ or body part. So these are the difference between local manifestation and systemic manifestation. When it comes to signs, these are already presented to you in your fundamentals of nursing. When it comes to signs, we are all, please be particular nurses when you are using the term signs, because these are more objective in nature. It may need specific observations. It may need specific results uh, that may specifically describe a deviation and consider it as a sign. That's why it's objective. It may need clinical evidence for you to say that the client is having problems with temperature. So that's why most of the signs, example of signs are our results of temperature, blood pressure, respiratory rate, abnormal heart sound, presence of mass, enlarged organ, and edema or swelling. So these are signs. But eventually, when we talk about signs, you must describe also the edema that we're talking about, which we have mentioned if it is non-pitting or pitting edema, enlarged organs, which is specifically if you say, oh, one of the signs is the enlarged organs, but how you will say it's enlarged. So it is basically the reference is the result of the diagnostic exam, ultrasound, X-ray, and so on. Mass is could be a presence of mass in the part of the body, and it could be described accordingly. The mass, if it is more presence of mass on the specific part of the body, and describe if it is movable, non-movable, so with fluid or none. So those are objective. So we are on the term specific. When we talk about symptom, okay, it refers to the patient's awareness of abnormalities or discomfort. These are not measurable, are based on the patient's subjective perception. Okay? So, just like for pain, for us nurses to identify the pain, we need the client to respond and use the pain scale. We can present a tool, but the client can still have his perception of what level of pain she or he is experiencing. So it's a symptom. When the client there is no measurement of nausea, weakness, fatigue, dizziness, and drowsiness. So it's always coming from the perception of the client. If when it comes to science, it comes from the specific results of the what? It comes from the specific results of the physical examination findings of the client. It could be coming from the specific results of the vital signs of the nurse. So those are signs. But if it is symptoms, it could be based from the interview, gathered data from the interview of the client's responses themselves. So we are using asymptomatic nowadays because this is a disease which is obviously symptoms are not noticeable. It could be presence of disease but detected by the routine test. So just like one of the questions that I have received during the time of my talk last Saturday, sir, do asymptomatics can also spread infection? The answer is yes, if they are confirmed with the diagnostic examination that they are carriers of COVID-19. Asymptomatics, mild, moderate, and moreover severe, may cause or may be considered infectious. However, that's why it will just be on your conscience if you are consistently following minimum health standards. So no guilt at all if you may consider yourself as carrier. However, we cannot say it because it's somehow uncontrollable, but it could be prevented. Next is, what is self-limiting disease? A disease that does not require treatment to be cured, it will be resolved on its own. Okay, self-limiting. A typical example, chickenpox. Why chickenpox? Why the client who may have chickenpox may not subject for admission in the hospital? Because eventually, from the certain period of onset and its incubation time, it will be expected on the recovery. For self-limiting disease, what we need to watch out as nurses is development of complications. Do you know that for chickenpox, once this virus could be into a severe situation, may lead to a possible complication of pneumonia. However, if the client may have the chickenpox until with the appearance of the rashes, you will notice that there's a certain period that it will recover. Okay, it will be recovered. You will be recovered in the certain period of time until you are cured and may not need any hospitalization at all. The chickenpox nowadays may not require treatment, but there are also pharmacological management, which we have discussed in the pharmacology, that could be considered as an option. Okay, because that is for purposes of prevention of complication. So those are self-limiting disease, na disease that does not require treatment to be cured, but it will resolve on its own. So we have discussed idiopathic, iatrogenic, asymptomatic, and self-limiting diseases. And we have also differentiate the signs and symptoms. Now, we will now proceed to the most interesting part, pathognomonic sign. When it comes to pathognomonic sign, these are the signs which are eventually described. Once you mention a specific disease, you will expect that it could be validated that these characteristics is only particular to that specific disease. Example, when I say how can I differentiate chickenpox from measles? Okay, both of them have the what we call rashes. But are there any difference with the rashes? The rashes that appears in chickenpox are with fluid. Okay, so that's why it is called as vesicular rash. Okay, while in the measles, the rashes are flat and spread through pattern in the body, just like a spot, petechiae. That is macular rashes. So those, if we say okay, measles, macular rashes. If we say chickenpox, vesicular rashes, we can identify even one sign that is very particular when we talk about a certain disease. It represents a marked intensification of diagnostic sign or symptom. So let's start. So for example, pathognomonic sign of abdominal aortic aneurysm. You are aware, this is AAA. That's why nowadays, when you are experiencing epigastric pain, probably you will ask why they are subject for ECG. Because situations like that, one of the manifestations wherein may lead to the possibility of abdominal aortic aneurysm or AAA is one is if there is epigastric pain because of the pressure created through the blood vessels. Second is that of affecting abdominal blood vessels. And one of the pathognomonic sign is there's pulsating abdominal mass. What do you mean pulsating? Okay, you will see in the abdominal mass that there is a pulsating mass. You can observe a mass that are moving, pulsating, okay, in the abdominal area. So that is one pathognomonic sign. And as nurse, you need to observe. The client is possibly having abdominal aortic aneurysm. Okay, please check any pulsating abdominal mass. Among the signs that you may observe objectively, then that is one that is very particular with abdominal aortic aneurysm. Next. Next is Addison's disease. Addison's disease is primarily a problem with kidney. And Addison's disease are known as primary adrenal insufficiency. Adrenal is kidney. And hypocortisolism. Oh, if you remember in our previous slides, we have discussed about hypercortisolism. The Addison's disease is hypocortisolism. So opposite, obviously. So there is decreased production of cortisol. So cortisol are very important for as an anti-inflammatory function. However, if the client may have Addison's disease, the adrenal glands will not release cortisol. And what is the pathognomonic sign of clients with Addison's disease? Usually, bronze skin pigmentation. I know if you have discussed this in the integumentary system that uh, whenever we consider any kidney disease, one of the manifestations that you will see is a change in the skin pigmentation, and usually it's bronze. Okay, bronze skin pigmentation. But when it comes to Addison's disease, these are identified with adrenal glands. Kaya that's why it's insufficiency. From the term itself, adrenal insufficiency, the production of the cortisol is insufficient. Okay? Next po, amoebiasis. Okay? Amoebiasis is obviously from the term itself, amoeba, the client experiences diarrhea, but you can consider if it is amoebiasis, if it is bloody mucoid stool. What do you mean bloody mucoid stool? In the stool, there is already presence of blood. Okay, blood itself, the color of the blood, which is bright red, that are attached to the stool. And eventually, the cause of this is the amoeba is the one that causes irritation and damage to the intestinal tissues. That's why it causes the bleeding. And once the client defecates, the blood, the mucoid blood, okay, the mucoid blood are with the stool as it is excreted. So again, abdominal aortic aneurysm is pulsating abdominal mass. Okay, there is pulsation of the abdominal mass. Addison's disease involving the kidney, involving cortisol, decreased production. Then the pathognomonic sign is bronze skin pigmentation. For a client who may be suspecting of amoebiasis, the client may have bloody mucoid stool. Okay, next. Angina pectoris. When you encounter a term such as angina, it is the medical term for chest pain. And we have identified this in the discussion in pharmacology, specifically for heart diseases. Now, when it comes to angina pectoris, the sign, okay, the sign that you may identify as pathognomonic, if we say angina pectoris, this is referring to a chest pain that radiates. Okay, if it is just angina, it is only chest pain. If it is angina pectoris, the chest pain on the anterior chest wall also radiates with the different parts of the body. And once the client may have a closed fist, okay, a closed fist or hand clutching, and place it in and with this manifestation, okay, that is what we call Levine sign. Okay, ang sakit ng dibdib ko. When the client has closed fist and place it on the anterior chest wall, so that is already positive Levine sign, or that is Levine sign. So the doctor will ask you, the client's having chest pain. Nurse, do the client have other manifestation? The client has Levine sign, positive Levine sign, because of the closed fist placed in the anterior chest wall. Next is appendicitis. Okay. When it comes to the appendicitis, what you will remember here is two signs. Two signs you will remember for appendicitis. Robsing sign and psoas sign. How the Robsing sign is identified. The Robsing sign usually is when you palpate the left lower quadrant. Okay, sa left lower quadrant. When you palpate left lower quadrant, it elicits pain in right lower quadrant. Remember, you will palpate in the left lower quadrant, but the pain will be identified by the client on the right lower quadrant. That is Robsing sign. When it comes to psoas sign, when you flex the thigh, to the hip, you will flex the thigh, ha? I may not show it here on the screen. When you are about to flex your thigh, going to flexing your thigh to the hip, and the client expressed pain, that is SOA sign. Okay? So there are two things that you need to remember when it comes to ano. You can also assess this to anyone who's suspecting for appendicitis. Palpate the left lower quadrant, but the client address the pain in the right lower quadrant, Robsing sign. Then when the client when you flex the client's thigh to the hip, then the client address pain, then that is what we call psoas sign. Okay? So next is if the client may have the basilar skull fracture. Okay? When it comes to basilar skull fracture, so I think I have a picture on the other slide. Okay? So but before I proceed, I have to present this first. Okay, yeah, this is the one. Okay. When we talk about the basilar skull fracture, this is raccoon eyes. Okay. So, well, from the term Mr. Basilar skull fracture, basilar, okay, fracture on the skull, this is a result wherein there is periorbital ecchymosis. If you will encounter the term ecchymosis, this is usually a discoloration resulting from bleeding underneath, typically caused by bruising. Okay? So, 'di ba try to imagine that when the area specifically identified with the what to call this discoloration, dark discoloration, periorbital is around the eyes. That is what we call raccoon eyes. Now, what do you mean by battle sign? So there are two also that you need to identify for basilar structure. The battle sign is there will be ecchymosis on the mastoid. So where is your mastoid? Mastoid is in here. If there will be ecchymosis or discoloration of the skin, which is resulting from the bleeding underneath. So remember, bleeding underneath. If the blood doesn't comes out from the interstitial space and remain to that interstitial space, then that leads to the what we call ecchymosis. So can you imagine this with the raccoon eyes? Okay, the raccoon eyes and battle sign for basilar fracture. For the Berger's disease, okay, the Berger's disease, what do you mean by Berger's disease? I'll just go back to the other slide. The Berger's disease is also called as thromboangiitis obliterans, wherein if you've heard about Berger's disease, its description is mainly because of inflammation of the blood vessels. If there will be inflammation of the blood vessels, there will be claudication. If you will imagine this is the claudication. The claudication that we are referring is it will cause claw. Okay, claudication. And this is intermittent. If we say, what do you mean by intermittent? Intermittent, it may not happen, the claudication. Then there are instances that it may cause claudication, then it goes back again to its normal position. So that's Berger's disease. Okay, let us have a view of the first slide. Abdominal aortic aneurysm, if there is pulsation of the abdominal mass. Addison's disease is insufficiency of the cortisol and usually bronze skin pigmentation. Amoebiasis is a bloody mucoid stool, okay, wherein it considered a problem with the presence of the passage of a bloody mucoid. Angina pectoris, if the client may have Levine sign. Appendicitis, remember, Robsing sign and psoas sign. Robsing is in the palpation, okay, palpation of the left lower quadrant, but immediately elicits in the right lower quadrant. And we have the psoas sign when you flex the thigh to the hip and causes pain. Basilar skull fracture, you will remember too, raccoon eyes, and we have the battle sign. Okay, both are ecchymosis. For Berger's disease, this is related to the intermittent claudication. So if you have the mastery of this pathognomonic sign, it will really help with all of you. Let us now proceed. How about, sir, bulimia nervosa? Usually, bulimia nervosa is an opposite of anorexia nervosa. Anorexia nervosa is the client, okay, the client is not having an appetite. But for the bulimia nervosa, the client eats too much. The client eats too much, and the client eventually wants to vomit it out. That's for bulimia nervosa. So bulimia nervosa, one of the sign that you will consider is Chipmunk Faces. Okay. So Chipmunk Faces. The Chipmunk Faces is if there is parotid gland swelling. Are you aware of mastoiditis? Mastoiditis in colloquial is beke. So if the client, the chipmunks do have that, diba? when they have the swelling of the mastoid. There will be swelling of the mastoid, that's bulimia nervosa. Another is if there is Russell sign. The Russell sign is if there are scraping on the if there is scraping in the knuckles. Why? Because the client puts the hand in his mouth and it causes the teeth, the teeth of the client touches this prominent part, and this is the one that are usually causes the skin integrity. So ipapasok sa mouth yan, then because the person wants to vomit and too much eating, then he wants to vomit it. So try to imagine that. Then it causes the scraping. So two, Russell sign, and the other one is chipmunk face. So that is for bulimia nervosa. So try to think of it. That if the client, bulimia nervosa is a problem with this is a maladaptive behavior. Okay, those who may have a problem with consciousness of the physical of the physique, rather physical features. Next, carbon monoxide poisoning. For carbon monoxide poisoning, you will remember cherry red face. Okay, so you have seen a cherry. Okay, the cherry that are usually found at the top of the ice tree. So can you imagine the color? And if the color of the cherry had been described to the facial feature of the client may have carbon monoxide poisoning. Okay, so because of the possibility that the toxic level of the carbon monoxide are reaching the different major organs. Next is the client may have the what we call cardiac tamponade. If we say cardiac tamponade, the fluids, the heart is protected by the pericardial sac. You are aware pericardium, right? The heart is protected by the pericardial sac, and if ever the heart is too much enlarged, the fluid goes to the spaces such as pericardial sac. So it may cause further enlargement of the heart. Okay, so usually this excess fluid that goes to the pericardial sac is what we call cardiac tamponade or tamponade. Then usually the signs, the pathognomonic sign is referring to a drop in the blood pressure, distended neck veins, okay, distended neck veins, and the other one is there is muffled heart sound. What do you mean by muffled heart sound? The normal sound that we are aware is S1 and S2, lub dub lub dub. But if you've heard the lub dub 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 dub, that's a muffled heart sound, which is very evident that there's already pressure created inside the heart. So that is what we call cardiac tamponade. For the carpal tunnel syndrome, some of you are familiar with the carpal tunnel syndrome. For the carpal tunnel syndrome, this is usually those who are usually using their hands vigorously in some of the activities. There are situations like may cause the possibility that in the carpal tunnel syndrome, it affects some of the irritations of nerves. This may cause irritations of the tissues. Okay, so most of the sign that we will consider for carpal tunnel syndrome is tinal sign. What do you mean by tinal sign? The tinal sign is this. If you have seen in the if you are seeing in the slide, the tinal sign is the sign that a nerve is irritated. Okay, what you will do is you will press this part. Are you seeing my Okay, you will you will okay, seeing the screen. Okay, this part, and you will press this one, this part of the hand. And then once you feel a tingling or pins and needle pain, okay, that is tinal sign. When you press this part, then there will be a sensation of tingling and pins and needles. Okay, so tingling. So you will feel that wow, there is somehow numbness and tingling. So that is tinal sign. That is an indication of irritation of the nerve. The other is, okay, we have mentioned cataract. You're familiar with cataract. So with the cataract, usually the problem is pathognomonic sign for it is cloudy vision. Cloudy. Cerebral palsy. For cerebral palsy, Okay, what is the problem with cerebral palsy? Usually with cerebral palsy, um, uh, uh, they have this problem with, obviously, with the brain, with the development as well. And when it comes to cerebral palsy, the sign that you can identify with the Caesar Caesar gait. What do you mean by Caesar gait? Can you imagine a Caesar that when the client walks, it's just like Caesar. Caesar. Ganyan siya lumakad. Open, close, open, close, open, close. So there's imbalance. Okay? So that is Caesar gait. Next. So I think I have mentioned this to a while ago about chickenpox. So that's vesiculopapular lesions or rashes. So these are the rashes that has fluids inside. Okay, vesiculopapular. But if you say popular occluded. Okay, it's occluded in the skin, but it has rashes. Can you imagine can we set an example? An example like when you are hit by a talaga cooking oil, 'di ba? Start it will cause redness and afterwards it may lead to the accumulation of fluid. So that is vesiculopapular rash. But the difference with the chickenpox, the rash is patterned and it has fluid. While on the when you are irritated caused by the cooking oil, it may only depend localized on the area that has been affected. So again, on the let us review the second slide. Bulimia nervosa, the client may have Chipmunk Faces or parotid gland swelling. And we have the Russell sign, scraping. Okay, there's scraping of the areas of the knuckles. Okay, carbon monoxide poisoning is because the client may have cherry red face. Carpal tunnel, the client may have tunnel. Okay, tunnel sign. Cataract may have cloudy vision. Cerebral palsy, the client may have seesaw gait. Chickenpox, and the client may have the what we call vesiculopapular rash. So we have the first two slides. So let's have a review. For abdominal aortic aneurysm, again, pulsating abdominal mass. Addison disease, which is renal insufficiency, the client has bronze skin pigmentation. Amoebiasis, the client may have bloody mucoid stool. Angina pectoris, the client may have Levine sign. Appendicitis, you will remember too. We have Robsing sign, palpate sa left, elicit on the right. We have also SOA sign. When there is flexing of the thigh to the hip, there is pain. Basilar skull fracture, remember too. We have raccoon eyes and battle sign. Raccoon is periorbital ecchymosis, where is discoloration brought about by underneath bleeding. And the battle sign is the mastoid ecchymosis. Berger's disease is an inflammation of the blood vessel, and there's intermittent claudication. So these are the first two slides. Let us now proceed with the next slide. Okay, before we proceed pala with the succeeding slide, I have mentioned to you about tinal sign. Okay, this is the tinal sign. Okay, I'm just projecting it on the tinal sign. So once you press this, the nerve irritated, there's tingling, there's pins and needles. That is tinal sign. For the Pallen sign, the Pallen sign is if there is a paresthesia or numbness, what you will do is you will have this Pallen's maneuver. What you will do is you will flex your wrist 90 degrees. Okay, flex your knee 90 degrees for 30 to 60 seconds. Okay, 30 to 60 seconds. So it could be two-way. This could be this way. Okay, this could be this way. Flexion 90 degrees. It could be this way, or it could be this way. Once there are numbness, medical term for numbness is paresthesia. There is tingling and numbness. That is positive Pallen's test. Okay. The tinal nerve, tingling, pins and needles, that is tinal's sign, positive. Positive Pallen's test, 30 seconds, okay, 30 seconds to 60 seconds, there is tingling and numbness, that is Pallen's test. Next. How about cholecystitis? Okay. From the term itself, chole, gallbladder. Okay. Usually, we are talking about cholecystitis if there is Herpes sign. Okay, there's Herpes sign. How you will consider that? If there's pain on deep inspiration when inflamed gallbladder is palpable. Example, your gallbladder is located on the right side, lower. When you palpate the right side where the inflamed gallbladder is located, then you will do deep inspiration Okay, there is pain, that is Murphy sign. Again, you will palpate right side, the inflamed gallbladder, then deep breath inspiration, then there is pain, that is Murphy sign. Okay? So, can you still remember it? So, kanina, when we talk about this one, okay, this one, press in here, tingling sensation, then that is tinel. When you have this 30 to 60 seconds, flexion of 90 degrees on this, and there's numbness, tingling sensation, that is pallid. Murphy sign, when you palpate, okay, palpate the inflamed gallbladder, inspiration, and there is pain, that's Murphy sign. There is inflammation of the gallbladder. Next, cholera. In amoebiasis, what's common with cholera in amoebiasis? It's a problem with the stool, okay, diarrhea. So once the client may have the problem with amoebiasis, there's diarrhea and there is passage of mucoid, buo-buo. There's a mucoid, bloody mucoid. Then when we are cholera, the client may have cholera, which is caused about by contaminated water, rice watery stool. Okay, rice watery stool. So just like a typical example, when you wash the rice, it's just the passage of the fluid itself. No fiber. So we have rice watery stool for cholera. Next, how about um, chronic hemorrhagic pancreatitis? This is common when you've heard about bangungot. The term that is used is mainly pancreatitis. And you will remember as pathognomonic sign is gray Turner sign. If for cholecystitis, it's Murphy sign, palpate on the inflamed, inhale, pain, Murphy sign. But for the gray Turner sign, from the term itself, gray. So there's somehow a problem again with discoloration. Usually, when there's pancreatitis, it may lead to possible bleeding. And the bleeding itself is the one that leads to the possibility of death of the patient when there is pancreatitis. So, the ecchymosis appears on the plank area. So where is plank? So the plank area is possibly at the present at the back. You can see on the lower back that there is a ecchymosis or discoloration of the skin appeared because of the blood that are being localized in the area. Next, if there is coarctation of aorta, coarctation of from the term itself aorta, okay, aorta. So this is the blood vessel that is connected to the left side of the heart and responsible for the distribution of systemic circulation. So the pathognomonic sign for this is notching of ribs. Okay, the notching of ribs is when we term notch. Okay, notch. Okay, notching of ribs is there is a problem with the formation of the chest. Notching. This one. Pag notch kasi we have this notching. So the notching of the chest goes like this. Notching. Hindi ko man mapakita, but the notching of the skin may have this chest appearance. So congenital hip dysplasia is a congenital problem, okay, a congenital problem usually for pediatrics, it's congenital. And so obviously it has developed accordingly with the problems and developed intrauterine. So congenital hip dysplasia, there's ortholannis click. What do you mean the ortholannis click? The physical examination is that of when you press the hip part as what you have seen on the screen, okay? Once you flex it towards the patient, towards the patient, there could be you could heard very audibly, you could heard click clunk can be heard. Talaga magka-clunk siya, yung click, madidinig nyo talaga yung, try to imagine a boat. Yeah, this sound, I hope you've heard it. And I know you are doing it. When you heard clunk, that clunk, that is a significant ortholannis click. Okay, which is very difficult, very significant for congenital hip dysplasia. Cushing syndrome, okay, class, remember, this is the opposite of Addison's disease, diba? Addison's disease is hypocortisolism. Cushing syndrome is hypercortisolism. That's why, class, one of the basic features of Cushing syndrome is moon pace. There's edema, okay? This is also a sign if there is a steroid overdose. Moon pace is also one. Okay? So usually the obese truncal obesity is there is a change in the body structure, but moreover you concentrate on the moon pace. If there is an edema or swelling of the face, just like in moon pace is the rounded. Cushing syndrome, hypercortisolism. Okay, for Addison's disease, what we are looking about as pathognomonic sign is the bronze skin pigmentation. Okay? Cytomegalovirus infection. A cytomegalovirus infection, this is usually an STD. Okay. And usually, owl's eye appearance is identified. So can you see an owl of the eye? So it is described accordingly. So this is one. Okay. So upon this slide, what you are seeing, this is the moon face brought about by the Cushing syndrome. And for the cytomegalovirus, actually the cytomegalovirus is herpes virus infection. And when you have seen in the virus itself, the virus, I'm sorry, when there is a microscopic evaluation, you will be seeing an owl eye. Yan. Owl's eye appearance of cell. That is cytomegalovirus infection. Okay, so let's have a review. Cholecystitis, Murphy's sign. So you will palpate the inflamed gallbladder. Then there will be inspiration, inhale. Then there's pain, Murphy's sign. Cholera, rise watery stool. For pancreatitis, gray Turner sign if there is ecchymosis or the discoloration or bleeding underneath at the plank area. Next, coarctation of aorta if there is coarctation of the chest or ribs. Congenital hip depletion is there is ortholantis click, wherein once the hips are flexed, there is a clunk, audible clunk that you will hear. For Cushing syndrome, the most common is moon face, and for cytomegaloviruses, there is owl eyes in the cell. Let us now proceed. When we talk about deep vein thrombosis, okay, the deep vein thrombosis is a problem with the blood vessels. Okay, if there is a problem with the blood vessels, one of the pathognomonic sign that you will remember is Hohmann's sign. And what is Hohmann's sign? So magkarugtong yan. Deep vein thrombosis, dengue fever. So pag Hohmann's sign si thrombosis, si dengue Herrmann's sign. Okay? Si Hohmann's sign naman for deep vein thrombosis, also called as dorsiflexion sign test. Okay? So what it will cause is once there will be if you will lift this part, okay, and it will dorsiflex, okay, dorsiflex, it will cause the dorsiflexion up, then flexion of the yung foot part going towards the patient, dorsiflexion, then there is pain. There is severe pain. So that is for Hohmann's sign. For dengue fever, the Herrmann's sign is there is presence of rashes. Kaya that's why for dengue hemorrhagic, you will ask, are there any rashes? Because if there are presence already of rashes, that is petechial rash, petechae, macular rashes, pinpoint rashes, and that is a sign of the what we call bleeding. There is already bleeding. That's why very important for us nurses to identify this observable term. How about for diabetic ketoacidosis? You will just remember in diabetic ketoacidosis if there's acetone breath. Yan. So the acetone, if you smell the odor of the acetone breath, parang it's just like fruity breath. Yan. Acetone breath. This is an indication of the problem with diabetic ketoacidosis. Next, diphtheria. So diphtheria usually if there is pseudomembrane. What do you mean by pseudomembrane? Pseudomembrane is if you will identify rashes, di ba pagka when the tonsils are checked, it's really inflamed. The nasal cavity has the redness, and usually up to the pharynx there is redness. You can see the pseudomembrane that we're talking about is there is lesions on the tissues or sores. So from the tonsils, the pharynx, nasal cavity, that's diphtheria. So we have already mentioned also Down syndrome. So Down syndrome is a chromosome abnormality. So ano yung pathognomonic sign? Single crease. Single crease. So one crease only. Tapos protruding tongue. Protruding. Yan. Protruding tongue. Emphysema. Emphysema is usually a manifestation for those who are smoking. Yan. For those who are primary smokers, you are high risk of emphysema. And usually for emphysema, there will be carbon dioxide retention. So can you imagine yourselves that you are not exhaling carbon dioxide? So barrel chest. Can you imagine a barrel that the size of the barrel is the symmetry of the symmetry and size of the anterior of the side lateral is the same. If the measurement of the anterior and posterior is the same as the the measurement of the lateral, of the sides of the body. That is barrel chest. That is because of the carbon dioxide retention. That's emphysema. O continue to smoke, you will have barrel chest. Next, enterobiasis. Enterobiasis is usually a problem, autoimmune problem, and usually nocturnal itchiness. What do you mean by nocturnal? Usually at night. It only occurs at night, and usually this irritation goes with uh, an irritation that are not anymore, itchiness rather, that are not anymore controlled. So that's why it's very irritating. It's very irritating. And usually for enterobiasis, uh, ang usual affected for enterobiasis, just like amoebiasis, uh, it still affects the intestine. However, for enterobiasis, okay, it's what you call a pinworm infection. Okay? A pinworm infection. For amoeba, obviously, it's amoebiasis. And we all know for amoebiasis, so we have the description of this stool, right? Di ba? Mucoid. We have mentioned the mucoid, bloody mucoid stool. The difference naman with enterobiasis, which is caused by pinworm, nocturnal itchiness. Talagang every night, it's caused by the pinworm. So, we have also called as the fifth disease. Okay? For the fifth disease, for those you have identified, mga pediatrics, infants, sometimes if you will see very irritated skin, specifically the cheeks, that is Pepys disease. Okay? When we talk about filariasis, this is the picture. This is different from elephantiasis, but however, in the filariasis, this is still caused by the problem with the virus, and usually this is carried also by the reservoir de mosquito. So the virus will cause the inflammation of the lymph nodes. So that's why most of the pathognomonic sign is lymphangitis. Okay. Now, German measles. Oh, you're familiar with measles. We have differentiated the chickenpox from the measles. So for German measles, we have the hoping I can pronounce it correctly. Forschmer's spots. Okay, so it's just similar. It's just a macular rash, macules, patches. Not patches. The spots, just the same as petechiae. Okay, petechial rash. So German measles. So we have also for the glaucoma. Okay, glaucoma. What is the difference with glaucoma and when it comes to the what do you call that? With the other one, we have mentioned with the eyes. The problem with the other one is glaucoma. The other one is cataract. Okay, with the cataract, it's cloudy vision. While for glaucoma, it's tunnel vision. So that's the difference. Tunnel vision. So can you imagine the tunnel vision na the light are only the lights are surrounding around once you see the environment. Okay? So, how about gouty arthritis? I'm sorry. Okay, just wanted to emphasize. This is the what we call Forschmer's spot. Okay? For German measles, the rashes are not just only outside the body. The Forschmer's spot are treating enanthem. Kaya if we say enanthem, these are red spots. Okay? The rashes that are petechiae on the soft palate. Ayan. So, it appears in the palate. That's why for German measles, these are the most common. You will check the palate and it has the petechiae or the rashes that is Forschmer's spots. Now, gouty arthritis, the clients may have deposits. Oh yeah, I have mentioned about the gouty is the increase in the uric acid. So if there's an increase in the uric acid, the other substances in the surface or in the joints, or rather the other substances and the uric acid proceeds to the surface of the joints. That's why if you will see, these are topi lumps. Kaya for those who may have the gouty arthritis, try to check their fingers, and if it has the topi lumps, ayan, if it has lumps, ang tawag doon ay topi. Okay? Graves disease. Graves disease is a problem with, this is a complication of hyperthyroidism. Okay? Hyperthyroidism, so very obviously with the thyroid hormones, and too much secretion of the thyroid hormones may lead to the possibility of the complications of Graves disease. And this is one of the features of the Graves disease, may lead to exophthalmos. Exophthalmos, it may cause the protrusion of the eyes. Any protrusion of the eyes is termed as exophthalmos. Topi is lumps in the fingers. Okay. So Guillain-Barré syndrome. Um, the Guillain-Barré syndrome is ascending paralysis. So if we say paralysis, and if it is ascending is going up. Usually for Guillain-Barré syndrome, these are neurological disorder that affects the nerves, various nerves. Can you imagine that when the sole of the foot is touched by any object, they their feeling is the same as for first degree burn? And the one of the effect that since the nerves are inflamed, it may cause the specific paralysis. It will start from the foot, lower extremities, going to the abdominal until to the chest. That's why for those who may be diagnosed with Guillain-Barré syndrome, may lead to fatality. Why? Because the muscles are the ones that are being paralyzed. And one of the complications here in the Guillain-Barré syndrome, the muscle of the respiratory system is the one that are considered paralyzed. So that's why it may not facilitate anymore respiration. Usually, those who may have Guillain-Barré syndrome may have the thoracostomy, the opening in the trachea, tracheostomy, sorry, tracheostomy, and lifetime the client will be assisted by a ventilator. But the client is conscious. But because it may reach to the point that it will paralyze the respiratory muscles, the ventilator is the one that will help and assist for the functioning of the lungs. Okay. So let us now proceed with hepatic encephalopathy. With hepatic encephalopathy, the client may have pathognomonic sign of asterixis. If we say hepatic encephalopathy, the liver problem, that's why for those who are drinking alcohol, if you lead to the intoxication, if your liver were damaged and already affecting the brain, that's hepatic encephalopathy. That's why usually the asterixis is a tremor of the hand when the wrist is extended. When the wrist is extended, it resembles a bird flapping its wings. Yan, ganyan siya. Mga ganun. Yan. So this is the what we call asterixis. When tremors of the hand when the wrist is extended. I-extend mo yung wrist mo. Pag in-extend mo yung wrist mo, ayan, magkukos na magma-manifestation na yan. Okay? Asterixis. For herniated nucleus pulposus, this is usually from the term itself, hernia. Okay? This is usually tested when the straight leg test will experience and apply pressure. Straight leg, if you will see in this, straight leg, tapos will apply pressure and there is pain. That is what you call Lasigues sign. Okay? Next, we have the Herpes Zoster. Okay? So when it comes to the Herpes Zoster, there is this is a higher level of a complex version of chickenpox. Okay? Because the lesion, it is not anymore vesicular rash. It's already lesions that appeared. Okay, lesions. Okay, lesions that appeared. Usually for the adults, and the herpes zoster is brought about if there is already an infection. Usually, it's autoimmune. So the Hirschsprung's disease is related to if there is obstruction of the passage of the stool. Yan. So that the stool is ribbon-like stool. Okay? So we have talked about three stools na eh. Bloody mucoid stool for amoebiasis. We have the rice watery stool for if I'm not mistaken, it's diphtheria. And the other one, this one, is the ribbon-like stool for Hirschsprung's disease. So you may cluster those if it is related to stool so that you can be aware of it. So Hodgkin's lymphoma, when we talk about the Hodgkin's lymphoma, I'm sorry. When we talk about the Hodgkin's lymphoma, it's Reed-Sternberg cells. So usually, when the client may have the test, you've seen in the test that it is not clear. It may have red. Those red that appears on the cells are a sign of the lymphoma. So this affects the lymph nodes. The lymph nodes. Now, when it comes to the hypocalcemia are evidence of the problem with the level of calcium. Okay? What's the problem here? When it comes to the level of calcium, there are two signs that are needed to identify: the Chopstick sign and the Trousseau sign. Okay? When it comes to Chopstick sign, it's the twitching of the facial muscle when tap facial nerve. So what you will do is you will tap the facial muscle, then it will cause the twitch. That's what you call the chopstick sign. Whenever you touch, hindi ko lang makaya. So yan, dito. So you touch the facial nerve, then it causes the twitching. That's chopstick. It means you have a lower calcium. Next is throw show sign. For throw show sign, carpopedal spasm. What do you mean carpo? It will cause the spasm. What you will do is you will apply the blood pressure cup, stigmo cup, the blood pressure cup. Okay? Yung sa ating stigmo. Then uh, uh, proceed it into the highest level of the systolic pressure for 3 minutes. If it manifests this one, okay, it causes this spasm in this structure, that is throw show sign. Yan. It's throw show sign. And that is an indication of lower calcium. Okay. So I think I have discussed too much of the pathognomonic sign. Actually, we still have one to we still have this. Okay. However, probably I may just supplement it with the video. Okay. So we will stop until the discussion of the pathognomonic sign up to hypocalcemia, so that to process the what to call this, to process our asynchronous session. So I will stop the screen. I will stop the sharing already. So are there any questions so far? Why it did not stop? Are there any questions?
Din yung herpes zoster po ba?
Yeah.
STD po ba yun?
Yes, yes. Actually, yes. And usually, for those who may have those herpes zoster, it's autoimmune. However, there are situations like situations that we must compare it with the if on the version. Sometimes they associate also on the higher version of viral infection compared to chickenpox. But somehow associated with it. Pero the usual the usual lesions appears in the mouth. But for not, or for the other version, it's mild, it's on the trunk and extremities. Okay? So I think I may stop the recording for now.